Hello, everybody. Well, today I am joined by the wonderful Kate Oldham, and we are going to talk about something that a lot of people have asked me questions about: lymphedema, scar tissue, fascia release, wonderful things that I'm saying here that people might not understand. But that's what we're going to talk about today, isn't it? And you're going to share all your wisdom with us. So, hello, Kate, welcome. And I'm really, really pleased that we're having this conversation.
And thank you so much for the invite. These are subjects I love talking about, and I love working with people, and sharing the self-care techniques that we can really do, and all for free. I love free things, so yeah, everything we can do for ourselves.
You're absolutely right. And you've started that on a beautiful note. You've said the magic word self-care. And I really, really love that. So that everybody knows, I have worked with Kate after both of my surgeries, actually, and online. We've never met in real life, have we? It's all been online.
No, not
But
yet.
this is something that you can do. And it's all about you teaching how people can help themselves, isn't it? You've taught me so much. And I'm very, very grateful. And it is all about looking after yourself in a way, and you can explain that to everyone what they can do. We're not going to go into great details because we've got limited time, but maybe we might come back and do another conversation if people want to know
Yeah.
more specific. So would you like to introduce yourself and your skills and your talents so that people know where we're coming from?
Thank you. That's very lovely of you. Basically, I've been a complementary therapist for over 15 years now, and all through that time, I've been training and training in the cancer and long-term conditions environment. And through frustration of people just not receiving the advice on self-care that they really need, and being expected to go and pay for expensive trips to therapists and things like that that really don't help when you're trying to recover. When we all you need to do is give people the confidence to empower themselves to actually support themselves. So that's been my mission for the past 15 years, is to gain enough education experience to be able to put a self-care platform together that can support people during quite a traumatic time,
Mm.
and but maybe that they're still going through treatment, or they're coming at the end of treatment, but wherever they may be, actually empowering people to have the confidence to look after themselves.
Yeah.
So yeah, that's really important to me.
I really love that because it is about, isn't it? I think we're both, we want to help people, we want to empower people so that they can help themselves. We're both sort of coming from the same angle on
Yeah,
that one. And there is a lot people can do. And like you say, when people have been through treatment, in the middle of treatment, where at whatever stage they're at, sometimes we can get lost, can't we? Totally overwhelmed.
absolutely.
And having a
Mhm.
little bit of guidance and someone who sort of can just point you in the right direction really, really helps, doesn't it? For I think for our physical well-being, but also for our mental well-being as well, isn't it? It
Absolutely.
really does help, and I know that you provide that because, as I say, I've worked with you, and will continue to as and when I need it, which is wonderful. Um, so we're going to talk about lymphedema, which is a word I didn't really understand what it was until I got it
Yes.
myself. And I came to you after my first surgery for breast cancer, when I developed lymphedema in my actual breast, and I didn't even know that was a thing. But you also
Yes.
helped with, yes, it is, yeah, it is. You also helped with what we can do about scar tissue, because after any operation, there's scar tissue, and sometimes that can get a bit painful, and we need to do. And you introduced me to something that I'd not heard of before, fascia release. Have I said that correct? Myofascial
So
release.
so yes, we did two levels from memory. We did myofascial release, but also myofascial unwinding, which is about the emotional as well as physical trauma that we hold in our body, which is magical. It's
It,
absolutely
yeah,
magical.
yeah.
So yes, so that's a big topic on its own, and
Yes,
we'll
okay. So maybe
yeah,
we can maybe schedule another part two or something.
absolutely,
I'd love to,
absolutely.
because there is a lot, and it'd be nice to go into more details at a later date. But I think again, you touched on something really important there. It's about how we can help ourselves with obviously physical things that we can do, but the actual our mindset really can help as well, can't it? And something that I'm big on, I teach people all the time: simple breathing.
Yeah.
breathing and being in tune with your body. And again, that's something I do a lot with my clients, and I know you're big on too. How we get in tune with ourselves and listening to our body. And
Yeah.
I think if I'm right, one of the first things you asked us to do, because I first got introduced to you on a workshop that was a group workshop, wasn't it? And it was just, tuning into our own body, which is sometimes, especially after surgery, we haven't really done. We haven't
Yeah.
touched our skin. We
And
haven't.
people need to be ready.
Exactly. So
That's the important thing.
yeah, you're very
Yeah.
good at actually realizing that some people might not be able to. So
Yeah.
again, it's very, very gentle suggestions that you give people, isn't it? So I love that. So perhaps we really need to say to people, what is lymphedema? Can you give us a sort of quick breakdown of what lymphedema actually is? Because I didn't know.
Absolutely. Lymphedema is, you can get two types of lymphedema. There's a primary lymphedema, which is genetic, and a secondary lymphedema that has different causal factors. So, for example, it can be cancer treatment related, it can be surgically related. You can get lymphedema through diabetes, through obesity. There are lots of different triggers for lymphedema, but basically, if we look at the lymphatic system really quickly, and this is a very top line, really non-scientific look at the lymphatic system, basically what our lymphatic system does is it actually balances our body's fluids. So it works very closely with the vascular system and our capillaries at skin level as well. But it also works with our immune system. It's integral to our immune system as well. It works really hard for our body. And basically, the lymphatic system is there to work in conjunction with our cardiovascular system, but to keep the health of the whole body really on a balance. So it's a really finely tuned balancing act. And when our lymphatic is disrupted through surgery or through scar adhesions or through radiotherapy, lots of different aspects that can affect our lymphatic system. If that lymphatic system is damaged, then our lymph system has difficulty transporting, because it's a one-way system, transporting that lymph from the areas. So, for example, our legs or our arms or our chest, where we can hold lymph. And basically, when we're looking at diagnosis of lymphedema, we are looking at things like a difference in, if, for example, if it's in a limb, a difference in the size between limbs, or any pain or heaviness, or any changes in your skin condition as well. When we're looking at the breast or chest, there again, there'll be little differences of the texture of the skin, and the kind of size between, and again, that pain and heaviness comes in as well. And it's a strange pain, lymphedema. It's like a dull, heavy ache pain, just like somebody's been giving you a little bruise.
Yes, yes, you're so right. It's a strange feeling, isn't it? And you're right to say, it's noticeable sometimes in the look, and skin changes, isn't it? The size and the shape, but it is a lot to do with how you feel. And
Yes.
I know through working with you, the things that you suggest to help move that lymphatic system, get the drainage going, because that's the key, isn't it?
Yeah.
They really help. They help me feel better. They help me feel more comfortable. They do reduce the swelling a little bit, which is really good. But also it makes me feel better in myself, because I hadn't realized how important a good working lymphatic system was. I had no idea.
I know. Well, the beauty industry has now caught on to the fact that the lymphatic system is a beautiful way of taking toxins away, but also a really good way of actually balancing our whole body. So I'm, in one hand, I'm grateful that the beauty industry have taken to it. On the other hand, I wish our NHS would take it more seriously, because a lot of people are undiagnosed with lymphedema out there, and don't really know how to actually support themselves. So it's a little bit of a postcode lottery for people to get diagnosis and get support for lymphedema. So it's really important for people to understand where they can get help and support.
Yeah. And I think as well, it's something that I know we've talked about it quite a lot. I used to be in the education profession, and we've sort of said everybody needs to know this, don't they? If I had my way, it would be on the curriculum. I'm sure you agree with that. So
Yeah.
that we understand our lymphatic system. Like you say, it's almost as important as the blood and the oxygen going around that body, isn't it? That drainage, because we build up fluid all the time without really even knowing sometimes. And maybe we don't address it until we get a problem. But it maybe would be helpful if we understood it and maybe used our movement in a mindful way, and maybe could do these things from, an early age, maybe, to understand that. And like you say, if the beauty industry is getting onto it, people are going to start registering. And it
Hopefully.
definitely will help with puffiness, wouldn't it? On our face,
Yeah.
and just getting that fluid moving and draining properly, and how for our systems to work properly is helpful in so many ways, isn't it? So
Absolutely. So if you think about a lake or a pond, it needs that flow, otherwise there's that stagnation. So it needs to have those changes in water levels, and it needs to have those that movement coming through it so it doesn't stagnate. And that's exactly what our body can do. If we don't have movement, if we don't allow our lymph to actually move properly, and the good stuff to be carried around and the bad stuff to be taken away. And, our waste products need to actually leave our body.
yeah, yeah, they so do. And it leads me quite nicely onto a specific question that I've got for you that someone actually asked to ask you. And I will say to anyone, if you've got any questions, if you listen to this podcast, put some questions in the comments. We will come back to them and we will answer them if you want to. But I've got this one already, and it does talk about some of what we've talked about. So I'll read it as it is so that you can get the full
Yeah, sure.
bit. So I was asked, this lady has scar tissue from where she had a drain in her neck after having lymph nodes removed. And sometimes she says that still aches, and where they operated on the neck is actually still very numb. So, what advice would you give someone who's got, you talked about a dull ache, didn't you? And also numbness, because we can get numbness. What advice would you give someone for that?
So to begin with, and this is where the interruptions of the lymphatic system. So this person's had a surgery, and so they've had an intrusion into an area of their body. So in reality, then what we need to look at first is actually the skin around it and the scar. And as long as there's no tumor site and they are clear of and they've been given the all clear, you can start working on your scars, which will in turn help the lymphatic system. So if we imagine how a scar is made, so if you've got an incision and then when it knits back together, it doesn't knit back tidily. It can be all over the place. So you can have adhesions actually in that place. Once you start to very gently work on those adhesions, that then releases what we call the fascia around it. And the fascia is a really important, which I'll come on to in a second, a really important element. And once you release that fascia and really start to release those adhesions gently, and I'll come back to that point in a second as well, then you can actually start moving that area, and that will hopefully, and it doesn't always come back, so the numbness doesn't always go away. But what we can do by actually releasing and allowing that nervous system to actually get a little bit more movement and more connection, we can actually empower that area to actually behave a little bit more normally to what it used to be. After surgery, we're never going to get back to 100%. So that's something I will always say to people and be quite honest. We can't, magically erase what's happened to that area, but what we can do is actually say to it, you're okay. And that's one of the key points, is actually that connection of actually your brain and your body and your hand actually coming into that area going, that was not very pleasant, but you're okay. We've got through this, and we can actually work together to actually improve this area. So when we're looking at numbness, that can often help. There are other techniques that we can use for areas of numbness as well to actually help the different areas of sensitivity. But all of that will then in turn help that lymphatic, and hopefully just alleviate some of those issues that person is having.
Yeah.
Does that help? Before I go on to fascia and everything else.
It helps me understand. So I'm hoping that other people will understand that. But what I'd like to pick up on in that is that actually what you're really saying is so encouraging, because we can help. We can do something.
Absolutely.
And the
Yeah.
fact that, I know you said you're going to come back to it, but it's gentle. It's working, with what you say to yourself, your self-care, as much as the actual physical, isn't it? So having this kind of, you said it and you put your hand on your neck, for people that are listening to this, not watching, and you said, it's okay, I'm okay. You
Yeah.
know, we can.
Treat your body like a friend.
Yes, yes,
You
and
would treat it exactly the same way. If your friend was going through a trauma,
yeah.
you wouldn't be standing hands off. You'd be there comforting, and normally the hand on the shoulder. And that hand on the shoulder
Mm,
is absolutely an indicator going, you're okay.
yeah, yeah. And it
So
has,
why can't we do it to ourselves?
yes, you're right. People don't, do they? So I want people to really get that message. We can, I've just put my hands naturally on my heart center and go, this is how I care for myself,
Yeah,
loving yourself, that kind of thing. And it gives me comfort to do that. So again, that gentle touch, reassuring yourself, we got this, okay, we're going to do something to help. That will make a difference, as well
yeah.
as the physical things that you suggest, like you say, the gentle massage, that kind of thing. So you mentioned fascia there, didn't you? So do you want to talk a little bit about that? Because
So I will. So fascia is all over, it's a connective tissue that's all over our body, literally from head to toe, and it goes from skin level all the way down to cellular level. And it's amazing. It's the most incredible tissue in our body. Now, the downside of connective tissue is if it's disturbed, it can get quite grumpy. And when it gets quite grumpy, so for example, if I had surgery in my breast, that can actually affect the fascia all the way down to my hip. So it goes in slings. There are different assets to the fascia, and as I say, if it gets disturbed, it can get a little grumpy. So the reason that I was so intrigued in early part of my training to understand fascia better and to work with it was just the magic you can have with really simple, gentle techniques with your skin and with your fascia that you can release with very little effort.
mm,
I like things that you can fit into your life that take very little energy out, because once you come out of treatment, your energy levels and your fatigue levels are quite high, and your self-care, you're being expected to do so much self-care because you're out of the system now. So myofascial release is something that is really simple and really easy to do for yourself, and it's easy to teach to others as well. So that if you've got a surgery site that is inaccessible to your own hands, there are simple techniques that we can learn to actually teach somebody else to actually help us as well.
yeah, that's a really good point, isn't it? Because we can't always reach the
No,
bits.
we can't always reach where we need to.
Yeah, exactly. So we might need to get someone else involved,
Yeah,
which again can be really good. It's self-care still, isn't it? But getting someone else to help you. But
absolutely.
I know some of the things that you actually taught me was a lot, when we worked on scar tissue, because that can get really lumpy and hard and numb. And
Yeah.
as you say, that gentle, I think was that fascia release on the scar tissue? Have I
It
got?
was, yeah, it's a combination of things. There are massage techniques as well as fascial techniques that we use when we're working on scars. And the reason that we do it in a really gentle manner is that there's already trauma in that area. Why would you add more trauma? And I know it's the old way of doing things where, you get old practitioners that go, right, you've got to go in hard and heavy and really, smash out that scar. And it fills me with fear.
Mm,
Um, Whereas in reality, our body and mind have been through enough,
yeah,
and it's now time to support. So rather than going in and poking the bear, as my friends would say, we're going to go in and just stroke and see how it feels, get that connection, and then you feel those nuances of change as well,
yeah.
and that makes a difference.
And that's such an important point, isn't it? We are, like you say, fatigued when we're going through treatment, and after treatment we have been through major trauma, mind, body and soul, haven't we? So it's so refreshing, I think, to go, we can actually have some really, really good results being very, very gentle and kind to ourselves, and that's what we need and we want, isn't it? So
Yeah.
lovely the way that you teach that. And I hope you don't mind me sharing, you know what you're talking about, partly because of all your training, but also because you've been through it yourself, haven't you? So
Oh yeah. I've had breast cancer, and it's left its legacy as well. So the radiotherapy wasn't the most friendly of experiences to my body. But again, it's for me, and everybody laughs when I say this, it's been one of the cheapest training courses I've been on.
yeah,
Because in reality, I've been learning about cancer rehabilitation for such a long time, being thrown into a diagnosis and the treatment. And I luckily went through everything. I went through chemo, radiotherapy, surgeries, etc., etc. So I had the full smorgasbord. But what that did, that not only taught me more about myself, but also taught me more about how hard it is once you come out of that treatment program. Because that support is no longer there. That kind of appointment book is no longer there. So you're sat there thinking, what do I do now?
Yeah.
How do I look after myself now?
Yeah.
And the NHS isn't there to do that.
No.
And it's not supposed to be there to do that. So we need to actually find ways of actually being able to support ourselves, because they're the ones that are putting us together and fixing, and and we've got some brilliant integrative medicine out there as well, so that it's not all just based around the NHS. There are lots of different options that people can go through, but we should still all be responsible at the end to learn about what our body can do, and how it's behaved, and what's changed, and how we can support that. And then I kind of base it around 4 pillars. And I'd love people to learn this before they go through any major trauma in their life. But if we have to instill it afterwards, then that's absolutely fine. But the basically it's listen, learn, love, live. And I basically, the reason that I say listen first is if we don't listen, we can't understand. And we can't even start to learn. And this is why all these gentle techniques are really important, because the gentle techniques really help us have that connection. So when we have that connection, we can actually understand, oh, if I'm touching here, but something's pinging over in my hip or my little toe, or why is that? Be inquisitive. So listening to your body signal and being inquisitive, going, I have no idea why that's happening, but you're unique. It might not ever happen to somebody else because you're unique. And this is where it's so important in self-care to have that connection. Once we've got that in tune listening skill, then we can learn about what our body is telling us, what we need to actually go and address with a medical professional. So if in doubt, check it out. That's one of my favorite sayings. If something and your gut is telling you that something isn't right, you go and get it checked out. If it's just a change in your body and you think, do you know what, that's just a change in my body and I understand it because X, Y, and Z, so radiotherapy, surgery, whatever it may be, these are just changes in my body, then you are on a kind of a learning pattern of actually being able to support yourself in an incredibly connected and intelligent way. But you don't need to have lots of qualifications. You don't need to know anatomy and physiology. This is about you connecting with you, because you're unique and perfect, by the way. So it's about that connection, and imperfections are perfections in reality.
Yeah.
Then we move on. So we got the listen. We learn about our body and what our body can do and what our body needs to alert us to and what we need to actually work with. By that point is where we start to love what we've got and appreciate and forgive and allow our body to some days have rubbish days. It's fine. We're all going to have ups and downs post-treatment. And, even if you're 5-10 years down the line, there are some days where you think the side effects from the cancer treatment, think, oh my goodness me, I have to wear my sleeve every day. I've got to do massage every day. And it's like, some days it feels like a chore, but most days I try and flip it to say, oh, well, it's like looking after my face and trying not to have wrinkles. It's about how you actually mentally flip it, rather than seeing it as a chore. And that's where the love comes in. So you change that language of, oh, well, I had radiotherapy, so I've got to massage that every day because of my fibrosis, blah, blah, blah. Whereas in reality, I'm going, oh, my skin feels really soft now. Or, it's changing that language into self-care rather than, as I say, I keep saying the word chore, and it does feel like a chore when you come out of treatment and you say, right, you've got to do your exercises and you've got to do your massage and you've got to do this and you've got to do that. And we do, but we may just need to change the language a little bit.
Yes.
So that's when we can live. And that's when we can discover what else we can do. And we discover new things, and we discover the old things that maybe need to be changed a little bit. So, working with ourselves, and that's when we can actually flourish.
Mm.
But that's my platform of how I actually look at self-care.
Yes, and I really like the way that you say that, because actually I know from experience myself as well, when you do tune into yourself and when you do start to listen to your body and respond, then you really feel like you are giving yourself the best care. And that is, oh, if no one's done it before, when you can step into that, you feel great, and that is, again, in your mind and physically in your body as well.
Yeah.
Listening, like you say, the 4 Ls, I really, really encourage everyone to start that, because some people never do, or some people have lost it a little bit, and so and like you say, we go through cancer, it's not all bad. We can then come out the other side, and actually we are loving ourselves more, because we need to, because we've maybe had a
Yeah.
bit of a reminder, a bit of a jolt, and we can do that. So there is that positivity, isn't there, connected with all of what we're talking about.
Yeah, there is, but I also, and I think we've touched on this in the past, people have to be ready.
Yeah.
And don't and be kind to yourself. If you're not ready, just understand why you're not ready. And if you need to seek further help from other healthcare professionals like counselors and groups and support, then seek those types of support as well, because that will then help you just build your confidence and help you make sense of everything that's gone on. And then you can start
Yeah.
that journey. And I think it's really difficult for people because they think I'm 2 years down the line, I should be doing this. Shoulda, coulda, woulda.
No, yeah, there's not a should, is there? There's no right time. I think I liken it quite often to a grief process, and it is grief. We have loss and change, don't
Yeah,
we? But there is no right or wrong. There's no rule book. We do it in our own way. Personally, and I've shared this a lot, with people, I've gone through a lot of anger. It still hits me from time to time, and I allow myself to feel that. I have a lot of positivity, but I also have a lot of crossness. I get quite cross about things,
yeah,
and I will go with that. All of the emotions that come up for me, and it's every single one of them, I will go with them when they come up, and that might be forever, and with me that's okay. This has happened to me, if you like. This is something I've gone through. I know it happens to loads of other people, but I've got a lot of emotions around it, and they
yeah.
all they all come up when they want to, and they're there for a reason, aren't they? So yes, everybody just go with it. We're all, like you say, unique. And can I just say as well, you had that your lovely 4 little pillars there, but also I know you've got some other things that you've said, that things for people to be aware of, that they can help themselves with as well. And it's another 4 pillars, if you like:
Yeah,
nutrition, hydration,
absolutely.
movement, and drainage. And those are things that we can do. So do you want to just briefly talk a little bit
Yeah,
about those 4 points?
absolutely. So when we come back to the lymphatic system, if we're looking at what the NHS pillars are, they are compression, massage, um, skincare, and sorry, my brain's just absolutely left me today. So
Okay.
compression, massage, skincare, and exercise. I'm an exercise professional. That's probably why it didn't come up to mind. That really helps. And also remember, folks, chemo brain, menopause brain, absolutely miracle I've got this far without fluffing my lines.
You're doing well.
Um, but they're the 4 pillars within the NHS. But with regards to the self-care pillars, they're very similar. So if you've been prescribed compression, then wear your compression because it's really useful and it does an absolutely amazing job. When it comes to skincare, and it's making sure that you're aware, and again this links into this consciousness of linking with your body, just being aware of how your skin feels. Is it hydrated? Am I eating the right things? Because if we think about the lymphatic system, it works on a waste processing system. So if we put more waste in, then it's going to have to deal with more waste. So it deals predominantly with fats and proteins. So, the proteins we need for muscle building and everything, but we don't need the fats necessarily all the time. So weight management is really important as well. And that really helps with the movement of the lymphatic system. Exercise and movement. The heart is the pump for the circulatory system. Our poor lymphatic system has to rely on us moving.
Yes.
Yes, so it's really important to understand that as well. So exercise and activity. I don't actually like the word exercise because a lot of people who come out of treatment get really phased by it. But even if you're cleaning the house or dusting or hoovering or going for a walk with a friend or doing a bit of gardening, that's activity. Sedentary behavior is the thing that we want to avoid the most.
Yes.
So that's what we need. So even if you're working, if you're back to work, get up and move every hour.
Mm.
Just get yourself moving, deep breathing, yawning, stretching, whatever it may be, just moving, dancing. Dancing is my favorite. So I've just become like Gromit when I'm dancing. So so it's one of my favorite things to use to
Moving.
move my lymph.
Yeah,
But
yeah,
connecting with your breathing, and I know you're such a queen of actually promoting breathing and connection, connecting with your breathing because that helps our deeper lymphatics move as well.
yeah,
So that's an absolute gem of something you can do if you've got a fatigue day and you feel as if you're lifting your little finger is too much. Just use some really nice deep breathing because that gets the accordion in the tummy going, and then that means that the lymph will move for you as well. And just paddle the hands and feet. So
yeah.
if that's all you can do,
Can be really simple, can't it? That just get
absolutely
going.
doesn't need to be complicated. We overcomplicate everything,
Yeah,
and it doesn't need to be complicated. So weight management is key, hydration is key. So I've got my water here.
yes,
And people think when they're swollen that they shouldn't be drinking, they should be drinking less water. Now, if you've got a heart issue or kidney issue, then you need to be working with your medical team on your balance of your fluids in your body. But if you haven't got those issues, then we need a really good balance in our body and hydration to come through to help that kind of movement of fluid and balance of fluid through the body. So it's just really important. And again, none of these should be expensive and none of it is rocket science.
yeah, yeah.
So, there are really good nutritional advice out there. There's really good, how much should I drink for my body weight type of thing out there as well to get so you understand how much you should be taking in. There's lots of different styles of activity. Go and try things. If it feels expensive, rather than have a rubbish birthday or Christmas present, get somebody to buy you vouchers.
Yes, yeah, great idea.
Try different things. Social prescribing through the GP. Don't be afraid to ask the GP for help with all of these things as well.
Yeah,
So because that's important as well. But also find a group that can help and support and motivate you, whether that be a family, friend group, support group, whatever it may be. If you can't self-motivate, and I'm rubbish, I will absolutely hold my hand up to this. I'm not a self-motivator. I need to be going, right, I've paid for that, so I need to go.
that sometimes works, doesn't it? That does
Yeah.
work. But
And
I,
again, everybody's unique.
everyone is unique, and I think
Yeah.
sometimes the fact that I know for me, I know that I will feel better. And the other thing is with a lot of this is I feel uncomfortable, so I do the movement and I feel better. So that's motivation. So,
Yeah.
and I know I've said to you, my worst time is after a long car journey. And because I've been still and I've held myself tight and I'm not always remembering to do the deep breathing.
Yeah.
Because you said it to me, didn't you? Well, what can you do when you're in the car? And I went, nothing. I can't do anything. And then you said, well, you can breathe. And I thought, what am I doing? I don't remember the simplest things sometimes. So sometimes it is nice just to talk it through with someone, have a reminder, because there's a lot you can do when you're still. Um,
Yeah.
but but I know that's a time that I feel really uncomfortable if I've been still for a little while. So a little bit of movement, a little bit of the breathing and getting things going makes
And
all.
and moving this.
Yes, moving the neck and
You'd be amazed, just moving the head and neck, because all of our lymph comes into this central point here.
yeah,
So moving your head and neck helps all of this open up,
yeah,
and that's really important as well. So if you ever want help with again understanding the lymph system more, then come along to some of my lessons, and
yes.
that'll help.
Yeah, that's a beautiful way to point it in. I was going to say, where can people find you? I know you've got a YouTube channel, which you've got some lovely videos on, haven't you? So would you like to tell people where they can find you?
Yep. So the name of my company is My Simple Steps, and I know that Nadine is going to be very kind to put some links in for me. Um, I'm not very good at social media. I am on Facebook, but I do answer any queries and any information that you require through there. And you can also contact me via my website as well, which is My Simple Steps as well.
Keeping it simple. I love that so much. But yes, I will. I'll put all the notes underneath this video so people can get in touch with you. And as I say, if there's any questions that come up from what we've talked about, I think there is a part 2 coming, because there's a lot more that I think we can talk about, and we welcome any questions and we can be a bit more specific.
Absolutely.
So thank you so much for this today. I hope that's helped people with a bit of an introduction about how much you can do for yourself and a little bit more of an understanding of what we're talking about. So thank you so much for your time today, and I look forward to speaking to you again.
Thank you. And thank you for the kind invitation. Thank you very much.